Hello, Professor.
Hello.
I would like to ask you a few questions. We are going to do a series and we'll proceed in a true or false format. Our first question, is having twins guaranteed with IVF?
It's not guaranteed. In IVF, multiple pregnancies are actually a complication. We actually don't want multiple pregnancies to occur. That's why we take measures to reduce it. Thankfully, twin pregnancies do not occur with every treatment.
As soon as I start IVF treatment, I will immediately have a child.
This is not true. IVF treatment is a process. For some patients, this process is short. In other words, it can be completed in one menstrual cycle and the person can have a child, or more accurately, a pregnancy can occur. After pregnancy occurs, of course, the pregnancy process itself is also important. It needs to progress to delivery without any complications. If such situations do not occur, they need to try again. Some patients may have to make a great effort just to achieve this pregnancy. For this reason, this process varies depending on the patient, or more accurately, on the couple.
So, is IVF only done in cases of female infertility?
No, infertility is mostly due to both partners. In other words, there can be problems in both the man and the woman at the same time. That's why during evaluations we assess both the woman and the man together.
So, after the transfer, is it usually necessary to lie down and rest?
After embryo transfer, patients tend to be anxious. They worry about whether the baby will fall out, slip, or be lost. Especially they ask if the baby will fall out if they cough, strain, or stand up. There is no need for such worries. Because if the baby is going to implant, it won't fall out even if you cough, sneeze, or move around.
After an unsuccessful IVF attempt, treatment is not immediately started again. Is that correct?
That's incorrect. Because depending on the patient's condition, both egg retrieval and another transfer can be started after the previous transfer. Of course, unless your doctor wants to take extra precautions or intervene that month.
IVF is a painful and difficult process.
IVF treatment can be psychologically challenging. Sometimes the waiting can be difficult for patients. However, it is not a very painful process. Patients tolerate it well. The need for painkillers or complaints about pain are not very pronounced. It's more often the psychological aspect that can be exhausting for people.
Thank you very much, doctor, for your answers.
You're welcome. Thank you.